Now, after the procedure, since Dr. Daly did more than just a cardiac cath, was it appropriate for him for both he and the nurses to meet with the Berryhills and talk to them about discharge instructions?
Yes.
Was it appropriate for Dr. Daly to meet with the patient on the afternoon and evening of the procedure, as opposed to making them wait until late the next day when he could get back to them due to his surgery schedule?
And I think that was based on his schedule, that he wanted to go ahead and counsel them prior to going home that evening instead of waiting until later the next day.
In the review of the record, did you see any change in the condition of the patient between the afternoon and evening of the 15th and when he was discharged the morning of the 16th?
All of his vital signs appear to be stable.
Now, speaking of his vital signs being stable, did you find in the record as to whether or not Dr. Daly continued the medications for Mr. Berryhill after the stent procedure, including the Bystolic and the Vasoretic?
Nothing was changed. Everything that he was on when he came in for the procedure was continued.
Is that done routinely?
If they're on the right medications.
Okay. Why, can you explain to the jury why, after you put this stent in that has solved the blockage problem, why would you keep Mr. Berryhill on the same medicines he was on before you did the procedure?
Sure. Well, every medicine serves a different purpose when we're trying to approach heart disease. Number one, I think what we have to realize is just because you put a stent and opened up the blockage, that doesn't really mean that the person is cured or permanently fixed. The high cholesterol is still there, the genetics are still there. As we all age, that's a risk factor for heart disease. The medications, each and individually, and their classes of their medicines have all been shown to help reduce future events. So, for example, Crestor, when it was first introduced, did not have an indication to show that it reduced events, but every drug in its class, including Lipitor and Pravastatin, all showed that by reducing cholesterol, that reduced the future risk of heart attack. Studies have shown that ACE inhibitors, which was part of the Vasoretic, again, is a multi-pronged approach, shows that it reduces the chance of future heart attack. The aspirin and Plavix are important because you have a fresh stent in there, and the metal of the stent will attract blood clots. So, again, that's mandatory to be on that. The Bystolic, again, is a blood pressure medicine, but, again, in this circumstance, it was used as a beta blocker because he had unstable angina. Unstable angina, as I described earlier, you want to slow the heart rate, you want to reduce the work of the heart, and so these beta blockers are indicated. In this particular case, Bystolic, I use quite commonly in my male patients because it has a good side effect profile.
Doctor, according to my calendar, the patient has been on Vasoretic since October the 3rd, and then had now been on Bystolic since the 13th, and was through the procedure on the 15th. Did you see anything in the record that indicated that he was having any problems or signs or symptoms or side effects or contraindications or whatever you want to call it while taking those two medicines for that length of time?
I'm sorry, from which period?
Okay. He started on the Vasoretic on October the 3rd.
Right.
Started on the Bystolic on the 13th.
Yes, sir.
And now we're all the way to the night of the 15th after the procedure.
Okay.
And during that period of time, did you see any indication that he had any problems taking those two medicines together?
As far as from the records, I can't see that he suffered from any side effects or untoward effects.
Now, we've heard a lot of discussions about the fact that the patient was sent home on 3 medicines.
Right.
Is it unusual for a patient who has this degree of coronary disease and has had to undergo the procedure that he's had to be sent home on 2 pills or 3 medicines?
It's not unusual at all.
Is there a reason, and we also heard that an issue about whether the Bystolic should have been stopped is there a reason that you would not just stop giving him the Bystolic?
No, again, as we talked about, heart disease is sort of like arthritis. Once you've got it, you've always got it. You're going to be on medicines for it. I wouldn't have stopped the Bystolic post-procedure because I feel like beta blockers are still beneficial for patients who've had coronary disease.